Donald Trump just issued a huge executive order, and he just got off of a press conference discussing that related to drug pricing. And I think we've got some very important information related to drug pricing for all of you in the healthcare industry, and even some patients. This may have an impact on you. What does this executive order do? Well, first and foremost, it requires that drug manufacturers provide the most competitive pricing to the United States. A study was done that determined that the United States was paying significantly more for drugs than any other country because other countries had negotiated better rates related to their healthcare systems. This executive order seeks to enforce the most competitive pricing for drug companies, which will slash the amount that they charge for certain drugs and bring that into the most competitive territory. We see this entire shift with Trump policies, not only with the tariffs, but also with this drug pricing. It appears that he's looking to achieve a measure of fairness with other countries across the entire federal government. The concern here, of course, is how does that affect individual pharmacies who have their individual prices? Well, everything seems to trickle down. Drug manufacturers are going to have to normalize their prices to the United States, which means that their drug prices oftentimes will have to be lowered for certain drugs. Those margins will be affected, and those prices will likely trickle down to the independent pharmacies and large pharmacy chains who may negotiate their prices or have to pay somewhat of a standard price. Expect drug prices to go down. I expect drug price margins to go down in terms of the profit that pharmacies are able to make. But I would also anticipate that there's going to be a significant reduction in the cost to the American consumer related to healthcare. Of course, we're still looking into some of the PBM litigation because I think that that's a much better fix in this scenario than just the drug prices. But of course, drug prices are going to bring much more PR for President Trump, and implementation is going to be a little bit easier. Let's talk about implementation briefly. Implementation of this drug price slash may be very difficult given that federal executive orders issued by Donald Trump have been slashed in many cases in the courts, cutting them down, preventing their implementation. I expect it's going to be a lot easier with this. I think that there's not too many arguments that could be made that would be publicly acceptable, that people would actually appreciate on behalf of the drug companies. And I don't think anybody's going to really like a greedy drug company coming in and saying, no, Donald Trump, you can't do this. Of course, there may be litigation. And if the drug companies decide to take a swing at Donald Trump and the federal government, I think that that's going to be an interesting fight that we will look out for later. But I ultimately expect a federal judge to say, no, you can bring your drug prices in line with the prices that you offer other countries. And I think that that would be great for the American consumer. And we are all for it. Now, pharmacies, potentially lesser profits. Certainly that's the case. However, the reality is that all of this stuff will trickle down. It'll just be a realignment of drug prices. And I don't think that those lower profits will be a sustained impact as pharmacies, drug companies find other ways to make revenue in this highly regulated environment. We see that happen all the time. I'm Ron Chapman from Safe Harbor Group. If you have any questions about this or more, feel free to stop by the Safe Harbor Group website, safehg.com. Send me a note there. Thank you so much for watching.